Gauteng Health Department says it won't be able to absorb all temporary contract workers who were employed in various categories during the COVID-19 pandemic. Those contracts are set to come to an end at the end of this month, March 2022, that is. It's due to budgetary constraints, according to the department. Let's get the reaction of Denosa, the nursing union in Gauteng's chairperson is Simphiwe Gada. Simphiwe, a very good evening to you. Thank you so much for being on News at Prime. So the department says it's going to have to let these workers go when their contracts expire, not because it wants to, but because it simply doesn't have the money to keep them on. Do you understand the reasoning? Do you accept it?
Well, thanks, Chairperson, for having us. Well, we have noted this press briefing today. I must emphasize that it is totally not acceptable to us, based on the fact that we know that the primary role and the important role that has been played by these workers has been very much visible. The strides that we have made in fighting COVID can also be attributed to their presence. The vaccination drive can also be attributed to their presence. So the not keeping these workers will be to take back the department, to reverse the gains that have been made. So we are not accepting that explanation. We believe that through dialogue and through open-mindedness, we can be able to find the resources to employ these healthcare workers. We believe that we've got to properly audit, the system of government, and we are confident that we'll be able to find money. For instance, to make an example, Chembekile, we were crying about the 749 post-community service nurses that had to be let go. And we took on government and were able to then audit the system. As I'm talking to you, the preliminary report that I received from the task team is that they found about 954 posts that exist within the system of the Department of Health, whereas they were ready to let go of 749. So we believe that they should not rush in pronouncing that they want to let go business of these healthcare workers. They should allow a process to unfold. They should bring their books on the table to us as stakeholders. We look at the books, and we should be able to also properly, do a forensic audit of the system to see which vacant funded posts are there in the system, which one have been filled, which one have not been filled, and we look at ways of then using the money that is unused in the system to take these healthcare workers. So we don't accept that explanation.
Simphiwe, you spoke about an audit of what's available in terms of positions in hospitals, right? At the briefing today, the Gauteng Health Department said all workers would be let go or kept based on the needs of the hospital and the money that's available. Is that not exactly what you are referring to, where there has to be an assessment of the needs of the hospital and the money available, and then a decision on who goes and who stays?
Well, that is what we are referring to, but the audit must not be done by them, because initially when they were dismissing the community service nurses that I was referring to, they said they did an audit. And when we came in, we said that let's do a task team so that there's transparency. And when we did the audit with them, we're able to then find posts. So we do not believe that when they do these audits, they do them in good faith. We believe that they need our assistance in order to be able to find these posts. For instance, when we were engaging with them on the nurses that were being let go, we already had with us, a number of available posts in the system which they could not locate. So that auditing process must not be done solely by them. There must be organized labor in there, must be able to look into the system. Like I'm saying, they said there were no posts, but we were able to find 954 posts in the system, whereas they said there are no posts. So we don't want to take their word for it, because the level of trust between us and them at this present.
All right. I think we've lost Simphiwe Gada, chairperson of Denosa in Gauteng. Simphiwe, we lost you there briefly, but I'm told we have you back. We have you back. Let me ask you about another issue today. The Gauteng government, the Department of Health, that is, today quite adamant that it's not broke. It also says that it's not facing a food crisis at hospitals. Is that a true account of the situation as experienced by your members?
Well, saying one thing is different from what our members are experiencing. So You know, you cannot say you are not broke, but you don't have food in the fridge. That for us is a concern. So that is why we are saying that we will be convening organized labor in the province and then going to meet with government. They must open the books to us. They must not only tell us verbally that they are not broke. We want to see the books and all that, because our members indeed, out of the goodness of their hearts, have been using their own cash to then buy bread. Of course, they were not forced. They were doing it out of their goodwill. But how does it happen that you even face a crisis of a shortage of bread? I mean, bread is a basic necessity that is not even taxed. How do you then fall short of that and you say you are not broke? So we don't want to take their word for it. We want to ensure that...
Pardon me, Simphiwe, the department says, yes, there was a shortage of bread for about, I think, a three-week period or so, but it says there was still regular feeding of patients, and for those, for example, diabetics, there was still a meal that was provided in the event that they needed something else to boost, let's say, their sugar levels. Is that not true?
Well, we're not disputing that, but you'll agree with me that for the mere fact that there was a shortage of something, that for us is a cause for concern, because we've got a shortage of bread today. Tomorrow we'll be having a shortage of medication. For instance, it's not only the issue of bread, Tembegile. The waste collection was a problem. We had placentas there that were not collected, medical waste that was sitting there, and that is not this is not a healthy condition. So why were the service providers that collect waste not paid? Because we must be able to then look at all the challenges that were there. It's not only that issue. You may be able to give other choices of food that are there. But for me, I still say that you cannot have a shortage of bread and want to justify it, and then you say that you are not broke. We must see the books. We must not take their word for it. And this is a consequence, Tembegile, of exactly what we warned against, to say the total collapse of the Department of Health, the instability administrative in the Department of Health, not having an HOD, not having a CFO, not having, a DTG, supply chain management. These are the results of what we warned against when the department was caught up in the PPE scandal, to say we've got to take a cautious approach and not cripple the department. Now we are beginning to see those things that we warned about. So we don't want to take their word. We want to see, and then we'll believe and confirm that the department is not in a paralysis state. And at the same time, you can't be letting go of workers, critical workers, and then you say that you are not broke.
Do you trust?
Us, we don't buy that.
Pardon me for jumping in there. Do you trust the people who are in charge of the department at the moment, from the MEC to the DG and all the way down? Do you trust them to be the team that sorts out all the issues you've just listed?
Well, we do think that they've got the ability, as long as they work with us in a transparent manner. We think that there's room for improvement. That's what we think. But for that to happen, remember, the political office does oversight. You need to strengthen the administration. You need to have a clinician-led administration that will understand the challenges of health and be able to meet them. So we've got to look at ensuring that these critical posts are filled with people who have got a health background. We don't just take people who do not have a health background. Those who've got a health background combined with the management or administrative background, that is what is going to take the Department of Health out of this crisis that it is in.
Simphiwe Gada, thank you so much for your time tonight. Simphiwe is the Gauteng chairperson of the nursing union Denosa. Thank you very much, sir. Amnesty International says it's concerned that if government does not urgently intervene to stop sporadic attacks on foreign nationals in South Africa, the situation could escalate. That follows violent clashes this week between migrants and locals, led by the Alexandra Tudula movement. The group claims that foreign nationals are taking jobs away from South Africans.
We should be holding governments account for their lack of action on certain things. But it doesn't mean that you have the right to take the law into your own hands and to violate other people's human rights. Our constitution provides that anyone who lives in the borders of South Africa, no matter who you are, where you come from, what your status is, you are entitled to your human rights. You're entitled to your right to safety, security, dignity, and life. And this is why we've said before, leadership, political leadership, government leadership is very important. We've seen so many comments from political leaders which actually fuel this kind of xenophobic fighting that we're seeing. And people really need to be careful with their words, because it's escalating the problem. And we don't want to see what we saw happen in 2008, 2019, etc.
Well, the international NGO is also calling for tough consequences for those who break the law.
Our problem is that there's actually been no accountability. I mean, if you're doing something illegally, you should be arrested. And so we've previously highlighted how past acts of violence, including the killing of foreign nationals during those xenophobic violence, have gone unpunished. And this leads to this entrenched culture of impunity. So we give the message is it's acceptable to do this. So actually, if you are breaking the law, and that means if you are going and ripping down someone's stall on the side of the road with no authority, you should be arrested. There needs to be consequences. Otherwise, people are going to keep thinking that this is acceptable.